My name is Lelaine. I'm the marketing manager for Momcozy, and I have a rambunctious 18-month-old right now. She is a tornado of a toddler, and so we are moving into that stage. But my breastfeeding journey was very challenging, actually, and so I'm really thrilled to meet folks like Dr. Wiseman. I actually only breastfed for 3 months because
Amazing.
and
That's
I did. You know what?
amazing.
You're right. I'm going to change the language.
Yeah, you're amazing. That's a huge accomplishment.
Thank you. I'm going to say I breastfed for 3 months. I'm very proud of it. And whether you breastfeed for a day, breastfeed for an hour, you are successful. So, I breastfed for 3 months and I did exclusive pumping. It was challenging at the time because I did not have a wearable pump and was a challenge for me. But I recognized the magic of breastfeeding. It was so sweet to see my little daughter drink milk, and making sure she got my antibodies helped with the anxiety that I had around sickness. So that's a little bit about my journey. Jessica said this is her third attempt at breastfeeding and her first successful attempt, and she's from Kansas. So
That's wonderful and amazing because often people will get discouraged after their first attempt and they don't get enough support and they're like, okay, next time I won't even try. So yeah, congratulations to you.
congrats. What about you, Dr. Wiseman? Tell us a little bit about your breastfeeding journey.
Sure. I have three children. Right now, their ages 13, 11, and 3. And I was very fortunate actually to be able to breastfeed all of them, despite being in residency for being a physician or being a single coverage physician in emergency rooms. I was able to continue pumping. I still don't quite know how I did it. I know there's so many hurdles. I think I had a lot of support from my colleagues, and I just kind of lucked out that things went pretty smoothly.
Yeah.
And yeah, and I breastfed my first one I had in mind 1 year. And I just, 1 year I cut him off. And that
Mhm.
was just
You're
didn't
done.
it didn't even occur to me to go longer. And that was fine because that was right for me and my family.
Right.
And then my second one, we went closer to like, I don't know, 16, 18 months. And then my third one, when I was fully educated about breastfeeding and teaching other people, I'm like, yeah, we're just going to keep going. And I think we stopped sometime after she turned 3. So yeah, it just became more enjoyable the more experience I had. So yeah, so that was my breastfeeding experience, but lots of figuring out pumping at work and
Sure.
traveling, bringing milk back. So I love advising people on that because it's like it can be kind of intimidating to figure out all those details.
It can, and I'm glad you brought that up because there's so many intricacies to breastfeeding, and I think when you get into it, you don't understand how challenging it can be. But as if you have the proper support and if you have these like tips and amazing peer support groups, it's amazing how you can be encouraged. All right, Stefan is here. She said, second baby, first time breastfeeding. She's from Iowa. Welcome to our live stream. Welcome, first time breastfeeding.
Oh, that's awesome. I'm so happy to see people giving it another shot when the first time was hard, but yeah,
I
wonderful.
love it. All right, it is officially 4 o'clock. We are going to get started with our Q&A with Dr. Wiseman. We're going to start over and we're going to do these every month just so you can share your questions about breastfeeding directly with her. We did gather 9 questions previously in our messenger, but before we get started, Dr. Wiseman, please introduce yourself briefly and we'll get right into it.
Hi everyone, I'm Dr. Colette. I live in Los Angeles and I do lactation consulting and breastfeeding medicine. I'm a physician. I'm an ER and internal medicine doctor, but I also have a specialty in breastfeeding medicine. So yeah, I love educating and helping people to just make this an easier part of their lives. Yeah, that's it.
I love it. All right, we're going to get right into it. There are a lot of questions on milk supply. Individuals said her baby girl is 2.5 months old. She hit a drastic drop in supply. She went from 6 ounces per pump to barely an ounce. Can people get their supply back up and regulate? And when is it too late? Before it's too late. Talk a little bit about that.
Yeah, so supply tends to regulate around like 2 to 3 months. And the first question now is mom is pumping, so it does sound like the supply has dropped a bit. But the first question is whether your supply even has dropped, because sometimes your supply regulates to your baby's need. You don't feel so full. And moms
Right.
feel their breasts and feel like, oh no, my supply is gone because I don't feel so full. So
Yeah.
a lot of times it's just that they perceive that it's low, but it's actually not. If you're pumping a lot and you notice a big drop in your pumping output, it could be partly that your supply is regulated if you were just sort of pumping extra beyond what your
Got
baby
it.
needed. But if something happened, like you got sick or you weren't pumping as much, if you're under that 3 month window, go ahead and just try removing more. It'll tell your body, pumping a little more often. It'll tell your body to make more. Go back to a sort of normal feeding and pumping schedule. I find after 3 months, it's hard to significantly increase, maybe by a few months, by a few ounces a day. But you're not going to double your supply after 3 months usually.
Okay, that's wonderful. Kaylin Oliver asks, what do you recommend to help build your supply after, okay, same thing, after a drop of 3 months postpartum. So if she
So
dropped
first
the supply,
question,
what do you do?
yeah, first question, did it really drop or do you just feel like it dropped? Is your baby growing? Is your baby happy? Maybe everything's
Right.
actually okay. If you're, for example, an exclusive pumper and you just suddenly, like this mom who went from 6 ounces to 1 ounce consistently around the clock, I would
Mhm.
first look at your pump. These parts, they're not designed to last forever. They usually, if you're exclusively pumping, need to be replaced every 3 months. The seals, the suction, the valves often go. So replace all the parts. Make sure you
Okay,
have suction. Just like put your hand physically up to the pump to
functioning.
see, do I feel it's pulling? If not, call a pump company. If it's
Yep.
Momcozy or any other pump company, they are really supportive. I've done it myself for a pump where I couldn't get the tubing to stay in and they helped me right away. So just
I
get
love
help
that.
with the pump. If it's truly that like the pump is fine or multiple pumps still aren't getting any volume, just see what your body can do. Empty really well 8 times a day, see a lactation consultant. You do what you can do.
Yep,
Sometimes you're just kind of limited to what your body's able to do.
I agree. All right. Sleeping question. Baby is sleeping for 6 hours to 7 hours straight at night nowadays. She has dropped her midnight pump and she just feeds when she gets up in the morning around 5 a.m. Will my supply drop? Do I have to pump throughout the night to keep my supply? And she's also not eating more than 120 mLs and she pumps around 100 mLs in 30 minutes. So what's the question around nighttime feeds?
Yeah, I mean, I can't answer a really specific
Sure.
situation for anyone, unfortunately, because I would want to gather a whole bunch of more info, and that's where I'd say go see a lactation consultant. They'll
Of
kind of
course.
sort it
Yeah.
all out. But I will address the nighttime sleeping. So, okay, bottom line, if you're home with your baby and you're exclusively breastfeeding them and you're responding to their cues, you're fine. Let the baby sleep. Um, Fine for baby to sleep 6, 7 hours. Think about like 100 years ago, 200 years ago, moms didn't have alarms, they didn't have pumps. Somehow we all survived and got fed. So we're not designed to set an alarm, we're designed to listen to our baby.
Yeah.
But the big caveat I'll say is if mom is back to work and bottle feeding the baby, and then they're giving the baby too much in the daytime, and then the supply is dropping, that can throw it off. So it's actually our own culture, our own like forcing moms to go back to work really early and pump that can actually tank your supply. If
Wow.
you are bottle feeding your baby and you are not pumping enough for them, then yeah, you probably needed to pump overnight. So
Overnight. That's
that's the only situation where it's different. If you're home with them, just breastfeeding exclusively, the baby will wake you up if they're hungry. Just trust the
yeah,
baby.
they sure will wake you up. All right. Lexi Esposito asks, I mean, let's talk a little bit about periods. One, does your supply drop around your period? She's experienced a supply drop around her period. And I mean, could you talk a little bit about what affects that?
Yeah, it's all hormonal because you have surges in different levels of progesterone and estrogen before your period. Most people don't have any effect. So I don't want people to
Okay,
worry like, oh my gosh, everything's going to change when I get my period. Now it's like, I would say 75 to 90% of moms are just fine, not an issue.
sure.
You might notice, so the few percent that do get an effect, it's usually starting about a week before your period. That's when those hormones are surging. And you might notice it drops. Some people find if you notice that the first time you get your period, then next time when you're expecting it, take magnesium and calcium around the time of your period, like starting about a week before. It's not, we don't know if it's scientifically perfect, but people feel like it helps. So,
Okay.
and hey, we all need more calcium. So
Yep.
try some calcium magnesium supplements. Uh, but know that it's going to come back. It's just hormonal. It's just kind of a little dip in your supply, and it's going to come right back after your period.
I
but
love
most
it.
people do fine.
We're going to go to the questions that were submitted previously.
Yeah.
Is high lipase milk that tastes metallic or soap-like, is that true or is it just a myth? I'm seeing it all over TikTok.
It is actually true, and it's basically there's an enzyme that partially digests the milk that's already in the milk. Isn't that crazy? Like you're giving your baby digestive enzymes. I know, that's cool. Another thing to love about breast milk. But some people, if they let the milk sit either in the fridge or even in the freezer, that enzyme starts digesting the milk for the baby because it thinks it's in the baby's stomach. And it's not harmful, but it starts to smell a little bit sort of metallic, soapy. And people think the milk's gone bad, but it hasn't. And most babies will take it just fine. So please don't freak out if you put your milk in the fridge, you smell it, you're like, it's weird. It's not like sour, but it's just a little funny smelling. Don't even sweat it. Put it in a bottle, give it to the baby. It's going to be fine. If your baby tastes that milk and rejects it, a couple things you can do. You already pumped it 24 hours ago and it got soapy, it got some lipase smell. Put a drop of non-alcoholic vanilla in it. There's something about the vanilla that actually, I don't know if it binds to the lipase or what, but it offsets it and a lot of babies will take it. So 1 drop per bottle.
Great.
Just like the vanilla flavoring that you would put in a cake.
Yum.
1 drop per bottle. Yeah, it's really cool. But if the baby still doesn't like it and you think this is going to be an ongoing problem, you can scald the milk. Some people will have to do this where they pump the milk and then within a couple hours they need to bring it up to just under boiling temperature, and that deactivates the lipase and then it won't get soapy. But hopefully the vanilla taste will cover it for you. But
Now
if your baby may take it without vanilla as well, so don't even sweat it.
I love it. Individual did have a question about the S12 Pro, struggling to not collect milk. Any pump related questions, we're going to follow up with you directly. We always recommend you contact support at momcozy.com. As Dr. Wiseman said, there may be some settings that are off. There may be some situations that are off. So please message us at support at momcozy.com. Jen has a quick question. We brought frozen milk to daycare at 8 this morning. It was left out in our cooler part of the bag out the entire time, but it's still cold. Is it safe to drink? We always talk about milk storage, Dr. Wiseman. What do you think?
So I wasn't quite clear. Did the milk completely defrost and it was just sitting out and it's cool now, or is it still partially frozen?
That is a good question. Jen, can you put in the chat, is the milk partially frozen? Is it completely thawed and it is just cold? I think we just have a follow-up question there.
Yeah, so well, I can address both. I mean, if the milk's
Sure.
still partially frozen, you can actually even just put it back in the freezer. As long as it has ice crystals in it, it turns out that it's still cold enough that it hasn't started to get bacterial growth. If it's cool, like kind of fridge temperature, I would totally use it. Absolutely. And a healthy baby, that's not a premature baby, if it's still cool, sort of fridge temperature, go for it. You can also always use the sniff test. It's not perfect, but you open that milk, you smell it. If it smells like vomit, it's probably bad. If it smells like nothing or maybe a little bit of lipase smell, totally good to give.
I absolutely love it. All right. She said it was frozen when I brought it to care. It's completely thawed now. It's still cool. So I think the verdict is, hey, smell it, use it.
Yeah, give it within 24 hours of defrosting and it'll be fine. But I would put it in the fridge at this point, obviously. Keep it cool.
All right. We're going to go back to the questions that were submitted. This talks a lot about what is the amount of milk that is normal. Individual is 5, she had a 5 baby preterm. So baby is 5 days preterm. She's getting about 25 to 45 milliliters every 2 hours. Is that good? And what is good?
Yeah, it's a tough question because milk supply comes up slowly. So, and
Sure.
especially with premature babies, we find that the body doesn't produce milk quite as fast at the beginning. So I just want to, first of all, encourage her. This is amazing. You're pumping for your preemie baby. You're giving them liquid gold. Even if they're not able to take the milk yet, you're storing up liquid gold for them and creating a supply. So yeah, you're doing an amazing job. So if you're pumping every 2 hours around day 4 to 5, and I'm just looking at my chart here, you want to get, your goal is like around 150 to 200 mLs total in 24 hours. So then if you're pumping every 2 hours, we're looking at about, say, like 20 20 mLs every 2 hours.
Great.
So make sure that calculates out. Yeah, I think that should be fine. So it sounds like you're well on the way to having a good milk supply. It's going to increase drastically over the next few days.
Right.
By 2 weeks, you're going to be producing like 30, 60, or more like 60 mLs every couple hours. In fact, a problem we often see, and I'll warn this mom about it, we see oversupply because you pump and your body like whoop, creates so much. So once you get to 30 ounces a day, just stop, just slow down. Don't keep, slow down,
Sure.
maybe pump less often, pump for less amount of time, because you can produce double and you don't want to produce double. That's painful.
Yeah.
So once you get to
Unfortunate.
30, I don't care if it's this week or week 4 or week 8, that's where you hold it.
That's great. And let's talk just briefly. The question is, how much breast milk is enough for babies? Lexi asked to reap the benefits of breast milk. One, but I mean, really, how much is enough for your baby as well?
Such a great question. I wish we had a scientific answer, but what
Yeah.
we experts generally say is if you're getting a baby 1 or 2 bottles a day, so that's 3 to 6 ounces of breast milk, there is very likely to be a benefit. If
That's
you're if you're able to do that, great. If you're like pumping 15 times a day and you're getting a half an ounce total, honestly, I would say just for your mental health and so you can spend some time with baby, just stop.
yeah.
Because it's probably not a benefit and you're just torturing yourself. And I know it's painful and exhausting. So
Mm.
somewhere around, let's say 3 to 6 ounces, there's probably a benefit.
Oh, that's great. And I think that touches on, ladies, do what works for you. What works for me is different than what works for other individuals. And so really do whatever works for us for your family. We're going to go to a question
Mm.
that was submitted. Can I ask your professional opinion? When is the ideal time to stop breastfeeding and pumping and the weaning process? Some mothers stop when they reach 12 months. We say 12-month mark, I kind of reached this milestone.
Yeah.
However, some people like you pursued a longer duration. The individual wants to do it long term, and she's really sad about stopping her breastfeeding journey. So, what do you think on weaning?
Yeah, it's becoming so much more culturally acceptable in the US and has been in other cultures to breastfeed longer. So absolutely go for it. I think there's still a benefit to the baby. There's a benefit to the mom. It's really cool. I realized this with my third baby, who I mentioned earlier, I nursed into toddlerhood. It's a different relationship.
It is.
Suddenly it's about respect, personal, physical closeness. It's about setting boundaries. And of course, there's some nutrition in there, but it's such a beautiful thing. The World Health Organization says 2 years. So you're actually doing what you're supposed to for your baby, according to the World Health Organization. They say 2 years minimum.
Wow.
So no problem going longer. And I think the American Association of Pediatrics also increased their recommendations to 2 years as well recently. So yeah, benefits to the
For it.
baby, becoming more socially acceptable. It's normal in other cultures. In the past, this is what women used for birth control. They would breastfeed their baby until they're ready to have another one. They would go 2, 3, 4 years. And it would, if they're nursing frequently, would really reduce their ovulation. So
I
very
love
normal.
that. Very cool. All right, going to the chat now. Frederic asks, my baby has a really hard time coming back to breastfeeding after she's babysat for the weekend and given the bottle.
Mm.
So she's given the bottle and then maybe she's refusing the breast, I think. How can we transition from bottle to breast? And I'm going to add from breast to bottle.
Yeah. Yeah, I know those are two different issues, right? Because I get both.
You.
I see people who have the issue with the baby refusing the bottle and
Bottle
issues
refusal.
using the breast, and oh, it's so stressful. Make sure you're doing breast bottle feeding that supports breastfeeding. So what that means is two things. Number one, you need the slowest flow nipple possible. You want that baby to work for the bottle. If they find that the bottle is really easy, they'll be like, yeah, why would I take the breast? Because it's so easy when it just gets poured out of the bottle. So that means a slow flow nipple. It's in some brands, it's a preemie nipple or a level 1 or level 0. Just whatever bottle you're using, make sure you're using the slowest flow. And the second thing is paced feeding. And if you Google this, you can find links and videos on paced feeding. Basically, you're not just putting the bottle in the baby's mouth and pouring it in as fast as possible. You're making the baby pull that bottle in, work their cheeks. Again, we're like making the baby really work for it. You're gently pulling back against them while they're taking the bottle. Make sure they're pulling suction on it because that's what they have to do on the breast, right?
Mhm.
So we're supporting breastfeeding by bottle feeding.
I love
So
that.
those are the two things that are really important. That's why probably they're getting fed too fast and
Yeah.
with too big of a nipple opening. So those are the two things you can work on.
That's really great. And, those are, I got really nervous when I was teaching caregivers my preferences, about this is the way I would like my baby to bottle feed. And sometimes I got pushback on that, but please keep advocating for your baby with the caregivers, with the daycare. You know, this is the way that you want your preference to be, and don't ever feel bad about that. So I'm just going to add that as well.
Totally. You're the mom. And, especially as a first-time mom, people feel like, oh, the daycare people know better. They don't. You're the
You
mom.
do.
You know what's best for your baby. So you tell them. I mean, and I've heard horror stories like, oh, the nipples came back and they all had this slit cut in them. I wonder what happened. Like, seriously, guys, this happens. So you go into the daycare and say, listen, somebody must have cut this. Don't do that. I want the slow flow nipple. And
Love it.
this is your baby. You're the mom. So.
I love that. All right, latching. How long should a new baby latch and suck for? I don't know if I understand that question fully, but I'm sure you do, Dr.
I
Wiseman.
think they're asking a newborn. So in the first couple of weeks, if your baby latches on and is breastfeeding, should you leave them for 5 minutes, an hour, 2 hours, as long as they want? I tell people 20 minutes on each side minimum, 20 to 30. I don't want people going more than an hour, so like 30 on the right, 30 on the left, because I don't think babies fallen asleep by that point. And at that point, you just need to take them off,
Oh, drunk.
everyone get some sleep. Yeah. So I would say 20 to 30 minutes on each side. If your newborn baby is only nursing for 5 minutes and then they fall off and they fall asleep, they probably are not transferring milk well. They're getting sleepy. You need to get a lactation consultant to get help with that early on.
Mm,
So yeah, rule of thumb, 20, 30 minutes on each side, every feeding, about every 2 to 3 hours.
got it. I'm going to add a question here. How do you know the baby is full? I had that problem when I was breastfeeding. I mean, and that's what made me have a little anxiety. How do you know the baby is full when we're going from breast to breast?
Yeah, and this goes back to some psychology as well, because in our culture, we're all scientists, we're educated. We like to measure things, when we bake, we're like, okay, exactly half a cup of this. And suddenly you have this baby and you cannot see the milk going in their mouth. You have
Yes,
no idea what's happening. It's very disconcerting. So just know that that's normal to feel a little uncomfortable there.
fair enough.
That's why we say 20, 30 minutes. And I teach the moms I work with to really, bother the baby, stimulate them, keep them awake as
I'm
much of that
awake.
20, 30 minutes as they can. And we do frequent weights in the first couple of weeks, make sure they're gaining well. So the first
Mm,
couple of weeks, it's really hard. You're not quite sure, but then you're getting to know your baby. You're starting to know their cues. You might notice they get kind of milk drunk. I don't know if you remember that in your baby, Elena,
milk
like they're
drunk.
like, like totally milk
Yeah.
dripping out the side of their mouth, right?
Yeah.
That's a good sign. Their arms go
Okay.
limp. So I teach moms that, say the baby's nursing and you lift up their arm and they kind of make a fist and they go all tense. They're not done yet. But if you lift up their arm and they're like all floppy,
Good.
a sign they're probably satiated.
Oh,
In older babies, that the amount of nursing time can get much shorter. I've seen babies who can nurse for 5 minutes, get a full feeding, and they're just aggressive feeders, full feeding, and they're done. And you'll just get to know your baby, and you know that they're gaining weight well, and you can, by that point, you can feel your breasts and be like, "Whoa, they emptied that side in 5 minutes. I guess they're
yeah.
done."
I love
So
it.
it sort of becomes individual for each baby and mom.
Lexi, I'm going to get to your question in just a little bit. I'm going to add a question from what we received, and I'll get right back to you. Individual asks, I'm due soon, and we had originally planned to breastfeed, and I'd pump and use some bottles for my husband to also do feeds to get that support. But I keep hearing that depending on how often, babies tend to custom to bottles quicker and then stop wanting to latch as much or nurse, and that affects flow. So what is the dance between, I guess, introducing bottle feeding and, I mean, when will it impact the flow, your supply and the flow?
Preference. Yeah, I would try to breastfeed exclusively for the first couple of weeks if you can. When I have moms that are really exhausted or they're just, baby's not gaining weight, sometimes we have to introduce the bottle earlier. But try
Mhm.
and just breastfeed the first couple of weeks, really get that first period down, get your supply established. When you do introduce a bottle, and I'm a fan of bottles, all my kids took bottles. I had to go back to work at the first one 6 weeks, second one 5 weeks, third one I took 3 months. But you know, I had to go back and my babies had to be able to take a bottle. So I'm not pushing that you shouldn't be giving your babies a bottle, but
Yeah.
use that paced feeding I talked about earlier. Use a
Sure.
super slow flow nipple. So preemie nipple or level 0 or 1, whatever's the slowest for that brand. So like, for example, Dr. Brown's, I like the preemie nipple. And then Avent, their smallest nipple is a level 1. So just find
Mhm.
out which one is appropriate for the brand of bottle that you're using.
Right.
And paced feeding. So tell the caregiver, whether it's your significant other or a nanny or daycare, hey, this bottle feeding should take as long as a breastfeeding so the baby doesn't prefer it. It should take 20, 30 minutes minimum. So the baby doesn't get a preference for finding the bottle is easier.
Okay, got it. Okay, Lexi, I'm going to your question. And Lexi has kind of had an issue. She's used the slow full nipple, but it would take the baby 1 to 1.5 hours to drink.
Yeah.
How long should she be drinking for? She's 4 months old, so is that too long?
Question. Well, sometimes as babies get stronger, some of them will need to go up on a nipple size. As long as you
Okay,
keep it to that rule of thumb that it should take as long as a nursing session. So Lexi, if you're nursing your baby and she finishes in 15, 20 minutes, which is often what I see around that age, although some is still taking 40 minutes, you can go up a size of the nipple and bring that bottle feeding time down to approximately what your breastfeeding time is.
I love it.
Totally fine.
Awesome. All right. Leslie asks, the baby is nursing for 20 minutes, but my boobs still ache. What's going on with my
Or
boobs?
Yeah, that's a hard question because I think I need to know more about the baby. Or is this the same Leslie that has a 4 month old? I need to know
No,
like
it's
how old the
different
baby
individual.
is. Yeah, I think I'm sorry, Leslie. I need to know a little bit more about the situation because
Okay.
that's a lot of things that could be going on there. It could be totally normal. It could be baby's not emptying. Not sure.
All right. Sounds good. Praise asks, is it okay to breastfeed your baby after a 6 hour shift at work? Will there be a problem with the breast milk? Do I have to express first? So I think this may be around, is the milk bad if it's been sitting in my boobs for about
Oh no, yeah, no, totally
six
not. And
hours?
although I will say, if you've worked 6 hours, you haven't emptied for 6 hours, your supply might start dropping after that because being so full after, most people have to empty every 3 to 4 hours minimum to kind of maintain supply. That fullness can downregulate your supply. So you may want to consider trying to do a pump at work. But yeah, if you hadn't removed any milk from your breast for 6 hours, the milk that's in there is still good and fresh, totally
Still
good.
good.
It's basically there's almost contact between your bloodstream and the milk, and so there's like a continuous circulation. So it doesn't kind of just go in there and sit and get old. So yeah, it'll get continuously refreshed, which is
I
why actually if you drink alcohol and then your blood alcohol goes down, the milk alcohol also goes down because it's continuously getting refreshed from your bloodstream. Yeah.
I always loved Dr. Wiseman in one of our sessions said there's a lot of myths about alcohol and breast
Yeah.
milk. So, you guys can go to our page and make sure to see the pin post because she answers a lot of these questions. All right, we have 3 more minutes now. So I'm going to move a little bit quicker. There is a question. I used to breastfeed and pump and I pumped after my feeding. I recently stopped pumping and now I just exclusively nurse. Is this going to change my supply? And I actually want to go back to pumping so I can start stashing it in the freezer.
Mm. Yeah, I mean, depending on your baby's age, your supply may have decreased a little bit just because you weren't asking it to produce. If you were producing an extra 5 ounces a day and then you stopped asking your body to make that, your body thought, okay, I'll decrease the amount I'm making. But if you're under 3 months and you just stop, I would start pumping again once a day. Usually after the first morning feed is when you have the most volume. So you feed your baby maybe 7, 8 a.m. Go ahead and pump, see what's in there. Do that for a week around the same time every day and see if your body increases the supply. It may not, but that's the best bet.
Got it. Caitlin asks, not feeling full breast after feeds, and I'm waking up not feeling full breasts in the morning. So what if my breasts just aren't feeling full?
Yeah, this can happen for a lot of reasons, and it doesn't mean there's a problem. Your baby may be nursing more. They may be going through a growth spurt and just removing more from the breast. It might be the 2, 3 months supply regulation time when your body says, oh, I guess your baby doesn't need 40 ounces of milk a day, which they don't. I'll just decrease it to the 30 that they need or the 25 that they need. And so you don't feel this like intense fullness anymore. A lot of people around 3 months stop breastfeeding because they think they don't have any milk left for this reason. So please don't get discouraged.
Oh,
As long as your baby's growing, your supply is good.
I love it. All right. Jessica asks, I have a distracted 6-month-old at the breast. What are your tips for keeping them engaged? They're getting a little distracted when they're feeding.
Oh, that's hard. Yeah. And this can often happen starting around 3, 4 months. And there's some things you can do. You can try and feed baby in a quiet, dark room. You can turn on a noise machine, like a white noise machine, just to drown out. They're starting to be aware. It's so cool. They're aware that there's a world beyond where they are. You know, when they're born, they see this far. They see mom's face. Every week, they start to be aware of other layers of activity and people being around. So they know there's someone in the other room and that stuff is happening. They have FOMO. So, try and keep them calm, offer the breast frequently. They might start waking at night more because they're just not getting enough in the day because they're so distracted. But yeah, just kind of keep them calm, take them in a quiet place if you can.
I love it. And our last question for our session today, is it normal for a baby to refuse the breast during a growth spurt?
They shouldn't refuse the breast during the growth spurt. Other things that might make a baby refuse the breast is maybe bottle feeding that's not in a paced manner. So maybe if you're supplementing because you thought they didn't get enough from the breast and then they start to prefer the bottle. It could be that they're distracted, like we were talking about before. It could be that they're not feeling well. If they have a cold or their nose is stuffed up or they have an ear infection, they may not want to nurse as much. If your baby's actually not getting enough in and getting dehydrated, you haven't seen a wet diaper in 4 hours, 6 hours, I would touch base with your pediatrician because I'd want to get that baby checked out.
Oh, wonderful. You all had amazing questions today about breastfeeding. And thank you so much, Dr. Wiseman, for your expertise. I do want to offer a plug. We have a lot of these questions answered. Again, if you go to the featured post in our Facebook group, we have a lot of the Q&As that we've done previously, as well as recordings on webinars. Final words, Dr. Wiseman. What are your final words to the moms today?
Well, I'll also say if you have questions that come up later or you didn't get answered today, just put them on our Facebook page because I'm going on there every day and I'm checking for questions.
Yes.
Give you like a paragraph answer because I love giving advice and helping people out. So no question is too small, or yeah, please just ask away. You can even do it anonymously if you don't want to put your name there. Final words, just congratulations to all of you who are contemplating breastfeeding or already breastfeeding or breastfed for however long you did. I'm just so impressed. I know how hard it is. I really do. You're juggling so much, all of you, whether you're a single mom or first time mom, or you have 3 kids already. You're the center of your family. So keep it up.
Wow, wonderful. Keep it up. All right, everybody, that is it for today. Every month we're going to be coming back. So we will publicize the one in April, and we have some more fun things coming your way. So stay tuned. All right, bye, everybody.